Glaucoma is the second leading cause of blindness in adults in the United States, with approximately 2.3 million cases of glaucoma in the US. In today's video, I'll be talking about glaucoma. I'll be discussing its causes, types, risk factors, prevention, and treatment. Normally, in the eye, there is a clear watery fluid secreted by the ciliary body on the iris that fills the anterior and posterior chambers of the eye. This watery fluid is known as aqueous humor. Aqueous humor typically serves the purpose of nourishing the eye and keeping it inflated. The eye constantly produces a small amount of aqueous humor, while an equal amount flows out from the posterior chamber through the pupil into the anterior chamber, and then drains via the trabecular meshwork in the angle of the anterior chamber into the venous system. Physiologically, this flow of aqueous humor generates an average intraocular pressure between 10 to 21 millimeters of mercury. An overproduction or suppressed outflow of the aqueous humor results in an increase in the intraocular pressure greater than 21 millimeters of mercury, and this is what ultimately leads to glaucoma. There are two main types of glaucoma: open-angle and closed-angle glaucoma. So in regards to open-angle glaucoma, it's the most common type and accounts for 90% of all glaucoma cases. It's typically caused by secondary clogging of the trabecular meshwork or reduced drainage of aqueous humor, and this results in a gradual increase in the intraocular pressure, resulting in vascular compression and ischemia, which is decreased blood flow, to the optic nerve, ultimately leading to progressive visual impairment and chronic destruction of the optic nerve, which is the nerve responsible for seeing. With open-angle glaucoma, the drainage angle is still open and it typically affects both eyes. The symptoms are more gradual in terms of onset, and initially patients may be asymptomatic, but over time, nonspecific symptoms such as mild headaches, impaired adaptation to darkness might also occur, and a progressive visual loss, typically from peripheral to center, might also occur in individuals with open-angle glaucoma without any treatment. Open-angle glaucoma is also not a medical emergency, but intervention is required to slow down the progression of vision loss. With closed-angle glaucoma, this is less common than open-angle glaucoma and is typically caused by blockage of the trabecular meshwork, typically due to narrowing of the drainage angle, and this leads to sudden and sharp increase in the intraocular pressure, with intraocular pressure typically being greater than 30 millimeters of mercury, resulting in an acute destruction of the optic nerve without adequate management. The drainage angle in closed-angle glaucoma is also typically narrowed, and this could be primarily due to anatomical variants in individuals, or secondarily, it could be due to inflammation, trauma, enlargement of the lens, or anterior dislocation of the lens. It's also typically unilateral, meaning it typically affects one eye, and symptoms are typically sudden on onset, with reddened, severe painful, or hardened eye. It can also present with nausea, vomiting, frontal headache, blurred vision, halos seen around light, and on exam, the eye could have a mid-dilated, irregular, unresponsive pupil. It could also result in rapid permanent vision loss due to ischemia and atrophy of the optic nerve. And with the acute closed-angle glaucoma, this is a medical emergency due to the risk of vision loss. So risk factors associated with glaucoma. With open-angle glaucoma, this typically occurs in those over the age of 40 years, and it's also typically seen in individuals of European or African descent. Individuals with diabetes and also a family history of glaucoma are also at increased risk, as well as individuals with myopia, which is short-sightedness, and also steroid use. With closed-angle glaucoma, risk factors include hyperopia, which is farsightedness, advanced age, females, individuals of Asian descent, eye injury resulting in scarring and adhesion, as well as any condition that results in mydriasis, which is dilation of the pupil. The dilation of the pupil could further push on the iris, therefore leading to more narrowing of the chamber angle, which ultimately worsens the closed-angle glaucoma. Therefore, any medication that leads to mydriasis is typically contraindicated in individuals with closed-angle glaucoma. Treatment for glaucoma typically involves medications such as eye drops to either decrease the production of aqueous humor or increase the drainage of aqueous humor, even if the patient is asymptomatic. Adherence to medication is vital to prevent progression of the disease. Glaucoma is not something that can be cured, but with medication, the disease progression can be halted, whereas going off medication can result in a damage that cannot be repaired. If medical therapy fails, then surgical intervention is required. Surgical interventions include laser surgery or open surgery. Surgery can also be an alternative first-line therapy for patients with advanced disease at presentation. It is also important to note that for close-angle glaucoma, ensure both eyes are evaluated at presentation, even though it typically affects only one eye. General screening for glaucoma is not considered cost-effective, but it is currently recommended in the following patient groups: individuals with a personal history of diabetes mellitus, as well as any individual with family history of glaucoma, Black people over the age of 50 years old, and Hispanic Americans over the age of 65 years old. It is also important to have a yearly eye exam checkup, especially for those with increased risk for glaucoma. During your eye checkup, the eye pressures are routinely checked, and an increase could help in early diagnosis of glaucoma, especially in asymptomatic open-angle glaucoma. So in summary, glaucoma is a group of eye diseases associated with acute or chronic destruction of the optic nerve, typically due to increased intraocular pressure. In the United States, glaucoma is the second leading cause of blindness in adults. The main types of glaucoma are open-angle glaucoma and closed-angle glaucoma. Open-angle glaucoma accounts for 90% of all cases of glaucoma. It is slowly progressive and it initially could be asymptomatic, but it leads to bilateral peripheral vision loss over time. With appropriate treatment that lowers intraocular pressure, progression can be stopped before severe damage occurs. Acute closed-angle glaucoma, on the other hand, is characterized by the sudden onset of a painful red and hard eye, in combination with frontal headache, blurry vision, and halos appearing around lights. Immediate initiation of medical therapy is crucial to rapidly decrease intraocular pressure and prevent vision loss. If medical therapy fails, surgical options are also available. Thank you for taking the time to watch today's video. I hope it answers any questions you might have had related to glaucoma prior to watching the video. It would mean a lot if you could please leave a like on the video as well as subscribe in order to catch related contents in the future. I hope you have a great day. Thank you. Bye.